So hi everyone, my name is Israel and I'm the co-founder and CEO of Hyro. And today I'm going to discuss about the challenges and considerations when building a better digital patient journey for health systems with conversational AI. So we at Hyro, what we do is we simplify digital interactions by enabling healthcare organizations to deploy conversational interfaces at scale. And we'll talk about what is conversational AI. So basically in the past 2 decades, we see how human-computer interaction has constantly changed from putting everything on web to search to social to mobile and lately to conversational, so via chat or voice. And that comes from actually user expectations. And when we think about healthcare, then the patient's digital expectations in 2021 are very different than they were in 2020, obviously before COVID, but after COVID, they've increased by much. So the telehealth, digital care, and their basic expectation to get care, get service on every channel, everywhere, anytime. So what we saw is that health system recognized the need for conversational AI solutions, and maybe just to set the stage, talking about chatbots on websites, voice assistants on call centers, text bots on SMS, WhatsApp, Facebook Messenger, to really meet the patient demands. But what we've discovered is that the implementation process to really deploy these conversational AI interfaces at scale across multiple use cases, from administrative ones to clinical ones, to dealing with billing and patient portals, as well as different channels, can be very complex. So I'm going to go through a simple example of a find a physician use case to really highlight some of these challenges and potentially how to mitigate them. So the first generation of chatbots, we call them the if X then Y approach, meaning you define some sort of conversational flows and think about what users might ask you and how they might ask you. So for example, they might request to find a primary care doctor. But then what really happens is your patients are asking it a bit differently. Maybe they're saying, find a PCP, or maybe they're describing a condition or a symptom, and it wasn't really in your conversational flow. And so this if X then Y approach has failed in healthcare. And even though we see a lot of chatbots that are using it today, and while they are called chatbots, what you'll usually see is that there are clickbots, meaning that's basically a new setup for the graphical user interface in a much more compact way, but understanding natural language would be very hard for them. That's when we started seeing the second generation chatbots, what we call the intent-based approach. So pretty much the same, thinking about the conversational flows, but this time, instead of actually hard coding them, gathering a lot of data, potentially from a call center historical data or from some patient chats, etc., tagging this data, understanding the possible intents, and an intent might be finding a physician based on a specialty or finding a physician based on insurance plan. And an intent might be also the combination of these two, finding a physician based on his specialty and insurance plan. So after we've predefined these intents, gather the data, tagged it, train machine learning models to really understand which intent the users are trying to get to, and then follow this predefined flow. So you can see the example here of finding a primary care or a PCP. This chatbot would get it easily, but then if we'll ask a follow-up question of does the specific doctor accept Aetna insurance, even though the data is there and the data is pretty obvious, potentially we didn't really predefine the intent of looking whether a specific physician looks for a specific, accepts a specific insurance plan. So that's something to consider when going on this intent-based approach. And while it is powered by machine learning, there is a big disadvantage here, and that's you need a lot of training data, and that machine learning is a black box. It's really hard to find the origin of these misunderstandings. Finally, if you want to deploy on a call center or an IVR solution, for example, you get hundreds of intents, and you don't really want to get to press 117 to do this. Another consideration to have is really the maintenance of these assistants. So let's say you successfully deployed, what happened next? So data isn't static, it's dynamic, it's constantly changing. So think about the evolution of FAQs around COVID-19. We started by asking questions about travel, then antibody testing, then vaccinations. So you need to focus on content curation, or you want to automate parts of it. So how can we make conversational AI agile, adaptive, and scalable? And that's what we think about the third generation of assistant, a hybrid compositional approach of using knowledge graphs and computational linguistics. Knowledge graphs to really tap into existing data sources and allowing instant deployment and seamless maintenance, unlike manually designing conversational flow. So if you have in the data that Dr. Miller accepts Aetna insurance, you'll be able to answer it out of the box. You don't need to predefine it. The second computational linguistics approach allows us to get to high quality and improve very fast without relying heavily on data, such as machine learning models. So the idea is to remove the friction in gathering the training data, as well as improving. It's really easy to debug when you know what went wrong with the bot. So the hybrid compositional approach, as I mentioned, would be able to get to depth in specific use cases, as well as complete understanding of large taxonomy, ontologies, and knowledge bases, and to expand to various use cases such as scheduling and IT-related use cases, as well as platforms such as the call center, because it is a really open-ended conversation and not an intent-based conversation. So these are just some of the platforms that you can think of when deploying conversational AI solutions. Usually the easiest way is to start on the website as a chatbot, but then expand to mobile applications, voice assistants on call centers, and all the other platforms that patients are using. So just to summarize, in order to build a better digital patient journey via conversational AI, you need to think about open flows and intentless solutions. And that's really unlike the clickbots, IVRs, or these predefined intents. The second thing is you need to focus on automation, what happens on what's going on as time goes by to the data and how it changes, and not to focus on content curation and constantly trying to add more and more content. And finally, you need to look for a solution that gives you omni-channel. And by omni-channel, it's also supporting these non-graphical user interfaces, so these conversational user interfaces, such as the call center. Thank you so much for having me here. And if you want to discuss more, I'm happy to answer any question here on the chat or afterwards via email. My email is israel@hyro.ai. You can see it on the screen. And have a great rest of the day. Bye-bye.